So my name's Jamie Ware, and I'm with NNCC, and I'm just going to get going. So the problem is that Americans today cannot access primary care. We have a lack of physicians that is essentially nationwide. It affects every single state in the country. States now have the option to expand Medicaid, which also makes it difficult for folks to access primary care. There's lots of uninsured. That's going to continue with the recent Supreme Court decision on Medicaid. It's impossible to get same-day primary care appointments. And what happens at that point is then people end up going to the emergency room or just foregoing care altogether, which is expensive and not good for people's health. There are also third-party and private insurers that become the middlemen and sort of change the rules between the state laws and the federal laws that govern what nurse practitioners can do and how they provide care and actually getting that care to the patients. And this mostly affects low and moderate income families. So nurse practitioners can help. For over 30 years, nurse practitioners have been proven to provide excellent primary care. It's in fact what they are trained to do. But the legal barriers for these guys are really at the state level. Access to providers can be expanded with changes in scope of practice laws. We see this a lot on the West Coast, where nurse practitioners can practice the most independently, all the way to where they have to have complete supervision with a physician, which is very restrictive for their practice. And since physicians are hard to come by these days, it's hard to find the supervising physicians. So states can also ensure nurse practitioners can practice fully in their states by considering the state exchanges and trying to negotiate with the insurance companies to make sure that those insurance companies don't discriminate against nurse practitioners as primary care providers. States can actually mandate and then enforce these rules, and it's really all in the hands of the state. The evidence proves it. Over 30 years of studies, and in fact a meta-analysis that just came out last year, shows that there are no appreciable differences between the care that nurse practitioners provide in relation to the care that primary care physicians provide. And this is really important. If they can provide the care, it doesn't make any sense that a nurse practitioner in New Mexico can practice independently while a nurse practitioner in the state of West Virginia or Florida can't practice to the same extent and to their full scope and ability just because the authority rules or the scope of practice rules in that state say they can't. It's very arbitrary. A RAND analysis that was conducted on behalf of the state of Massachusetts indicated that billions of dollars could be saved by utilizing nurse practitioners in the primary care system, and this savings was realized by lowered emergency room use and other factors. So with that, I just want to reiterate that the strength of the evidence is very, very high for this intervention, this legal intervention, and the effect could be huge because you're talking about every nurse practitioner across the country. If all the 50 states made the right decisions about their scope of practice laws, then nurse practitioners across the country could really start filling in this gap in primary care services or access to them. So this is where we're at. We want to change the laws from arbitrary determinations of what nurse practitioners are allowed to do to what they really can do, which is practice to the full scope of their ability. There are political considerations in policymaking. As you know, this has not always been an easy road to climb for many policies, and it's particularly difficult for nurse practitioners. You'll see that nurse practitioners on their own, this is where we're at, where it's very, very hard to implement these types of legal changes on their own. I'm not going to get into the 1 minute left. I'm not going to get into the specifics of why, but I think that there's a little bit of turf battle going on at the state levels where some folks don't want people, specifically nurse practitioners and other types of practitioners, on their turf and practicing where they think that they shouldn't be. But it can't just be the nurses, guys. There has to be a broader base of support, and that's what I'm here to ask you today, is this is where the bar could be with your help. If public health researchers and advocates and policymakers really got together with the nurse practitioners and other nurse advocates and said, hey, we know that this is important and critical for the public's health and for primary care in our state, I think we could really make much more of a difference. So again, the intervention is easy, right? What we need is a broader base of support to just implement the legal changes and change the scope of practice laws and make sure that exchanges include nurse practitioners and their panels. and I'm getting the signal to stop. So I'm going to stop there. Thank you very much.